Council's webcasting and YouTube channels after the meeting is concluded, should anyone else wish to view it. Please be aware that this meeting is being transcribed only for the purpose of producing the minutes. The transcript will be deleted once the committee approves the minutes, and it should not be downloaded by anyone other than Democratic Services. To confirm, as a council, we welcome the use of the Welsh language in our public meetings, but I can confirm that I have not received any notifications or requests to use Welsh today. Therefore, the meeting will be conducted in English only. May I remind members to refrain from using the chat facility and instead use the raised hand icon to indicate when you want to speak. Please could you also keep your microphones muted when you're not talking so there aren't any interruptions encountered. I also remind members that as per the statutory guidance made under Section 4 of the Local Government Wales Measure 2011 and our formally adopted hybrid meeting policy, any member attending the meeting remotely must be able to be seen and heard by members and officers who are attending the meeting, as well as by members of the public viewing the meeting. So can I ask you all to please use your cameras for the duration of this meeting. Thank you. Moving on to the agenda. Could Jade, our Democratic Services Officer, please confirm if we've received any apologies, please?
Yes, thanks, Chair. We've had apologies from Councillor Cowles and Councillor Price this morning.
Thank you. Are there any other apologies? Declarations of interest. Members, do you have any declarations of interest with regards to the item we are scrutinising today?
Yes, Chair. So I chair the panel.
On the corporate parents and how I'm a governor at school.
I'm a governor at Woodland School, which is mentioned in the report, and a governor at St David's School.
John, any declarations?
No. The Archdiocesan representative of Cardiff and Mineria.
Jane, Councillor Watkins.
So I'm a governor at Our Lady of the Angels, Roman Catholic Primary School and Cwmbran High School.
And Victoria.
Can I declare then, Chair, I'm governor at Knight Kennedy School and I'm grandchild at Cwmbran High School.
Parent Governor Representative, Rescal Pantig.
Thank you. I'm on the Management Committee of the Pupil Referral Unit and the number of grandchildren attending schools. Yeah, I go around the back. YGG, Coediva Infants and Blenheim Road Infants and Nursery. Thanks. Any other declarations?
Chair, I'm Governor at St David's Roman Catholic Primary School.
Thank you, Councillor Clark. Any other declarations? No. That takes us to agenda item 3, update on the report. This is the progress and impact of accepted recommendations. The purpose of this report is for the committee to be provided with an update on recommendations that we have previously put forward as part of the scrutiny activity during the meeting held in January 2025 when scrutinising early years intervention. Can I ask Geraint to go through this report for us, please?
Thank you, Chair. During January 2025, the Joint Children and Families and Education Overview and Scrutiny Committee made numerous recommendations, all of which were accepted or considered for adoption by the Executive. It's sensible to reflect on to what extent recommendations made have been embedded and acted as a catalyst for delivering service improvement. The Strategic Director, Heads of Service and the Executive Member are in attendance today for any questions on progress you may have. Also, to ensure the impact of scrutiny is properly evaluated and recommendations are not just accepted but acted upon, a summary of impact has been produced by the service area against the scrutiny item, defining what impact of progressing was seen from the committee's scrutiny activity, and that's in Appendix 1. Please note you're not here to re-scrutinise the item, just to determine whether you are satisfied with progress in actioning your recommendations. If you're satisfied that your recommendations have been actioned appropriately, they'll be removed from further monitoring. However, if you're not satisfied with progress, then they'll remain on the monitor for further updates. So the update you're here to consider relates to the report on early years. So as you'll see, there's three recommendations. So just now to invite any questions or comments from members regarding those three recommendations. No? Happy for them to go off the... Yeah.
Aye. All happy? Online, you're happy? Thank you. Takes us to agenda item 4, healthcare, education and children's services, supporting the mental health needs of children and young people in Wales, including learner wellbeing. The purpose of this report is to consider how well the Council is ensuring effective partnership working with partner agencies to improve mental health support for children and young people. Before we commence discussions, I would like to welcome the executive member, officers and invitees to the meeting, and could we quickly go around the table to everyone to introduce themselves, please. Shall we start with Claire?
I'm Claire Williams, Head of ALM Inclusion and Wellbeing.
Alison Costa, Lead Educational Psychologist.
Jenny Wellham, Regional Programme Director for MIFT.
Good morning all, I'm Claire Warlock, I'm Group Manager for Children's Services.
Good morning, I'm Mark Griffiths. I'm a CAMS consultant and the Clinical Director of the Aaron Bevan CAMS service.
Good morning, Jacqueline Richards, Head of Children and Family Services.
Good morning everyone, Jason O'Brien, Strategic Director, Children and Family Services.
Good morning, Andrew Powells, Director of Education.
Thank you very much and welcome again. So, on behalf of the committee, may I thank the head teacher and staff and pupils at Woodlands Community Primary School for our very informative recent visit, which has proved really useful in preparing for today's meeting. I don't know whether any members wish to comment because I think it was an exceptional visit to the school. Yeah?
We have to say it was a very worthwhile visit and a good hour or so of our time. Thank you very much.
May I invite members to ask officers questions as per the order of our pre-agenda meeting? I think we have a list of questions and yeah, feel free. Sorry, have I missed something? Right. Apologies, I've missed a bit in my script. Members have all read the report, I'm assuming that anyway, and so we'll head straight to the questions. Please, anyone would like to make any introductory comments beforehand? On the report? No, I think we've all read it. We've scrutinised at pre-agenda really well, and we've got a lovely list of questions here. I think we've whittled it down a little bit, but we have 26, so sorry. And question 1 is for Councillor Thomas.
My question refers to paragraph 3.4. With the review and the key findings being an all Wales review, to what extent do the areas of concern highlighted under care experienced children apply to Torfaen?
Okay, I'll answer that as I currently manage our long-term planning and reunification team and our 15 plus service. So in the main, they are our children looked after teams. You'll know that the inspection covered all Wales, but there was a focus on Torfaen. Torfaen was included, as was the Aaron Bevan Health Board. So the information that came through, I would say, is reflective of what we experienced here in Torfaen. But in saying that, I think that Torfaen has developed a number of different services and multidisciplinary ways of working to try and bridge some of those gaps, which you will have seen from the health and social care response, but also from the items listed specifically within the report that details the number of services and multidisciplinary team meetings that we hold in order to try and, as I said, bridge those gaps and provide the level of care and support that our young people need.
Thank you. Councillor Thomas.
With reference to paragraph 3.3, what support are we giving to schools in Torfaen to address the attendance issues around the groups causing the most concern.
Oh, I'm sorry.
Sorry. What support are we giving schools in Torvine to address the attendance issues around the year groups causing the most concern?
Okay. In terms of attendance, I know that we've come as an education department and talked to the committee before about the strategies generally around attendance, so all of those would apply. I think what might be relevant here is if we talk to you about a pilot project that we've got at the moment. So you said 3.3, didn't you, the 11 to 16 year olds in terms of the attendance? Oh, sorry, I thought you said 3.3. I thought you said 3.3. I compared to 3.13. Yeah, sorry, I was in the wrong paragraph. I was looking at the word 3.3, apologies.
So we can talk through a few of the projects we've got in place. So Alison can talk about the ELSA project, so emotional literacy support assistance. We also have the counselling service, which Alison oversees, which she can talk about. We've also got family engagement officers that we provide funding specifically to secondary schools for. So that's for bespoke work with those families that are struggling with attendance. And then Claire and Alison can both talk about a new targeted project we have for those who've got emotionally based school non-attendance. That's something we're just instigating now. So I'll hand over to Alison and Claire.
So it is still relevant to the same age group, those 11 to 16 year olds, but we have been working with an external consultant because the research and the support around pupils who are EBSNA, which is emotionally based school non-attendance, is still quite sporadic, I would say, across Wales. There's no sort of central guidance document at the moment to refer schools to. So Alison has been working with the consultant to develop a pilot project so we can start to look at some of the reasons behind why children are presenting in this way and you know, at what point that might start to happen, and the lessons that we can take from that then in coming up with some guidance that we can give to Torvine schools. Do you want to talk more specifically about the year groups that involves?
Yeah, so we're using some grant funding to procure this external consultant time, but because it was a national priority for the whole school approach funding, but we've decided to use it in this way, and we are looking at the transition cohort particularly from year 6 to year 7, because we know that that's when children do often might have attended well at primary school and then attendance declines at that point if they've got anxiety and other mental health kind of needs in the family. So that project is just started in September, so we're going to see how that kind of evolves over the course of the year and what the ongoing impact will be. But it's planned that we will look at that transition cohort and think about how we can work across all the systems, so with children and young people, with families and with schools, and bring them all together to ensure that we're aware of what the factors are that are impacting and also what helps. So we're going to trial some interventions this year and see what the longer term impact of that is. We're also looking at the current year 8s. This is in a cluster. In one of the clusters, we're looking at the current year 8s to determine what, after transition into year 7, what happens ongoing into year 8, and where we've had cases where either attendance has started to decline over the course of year 7, what some of the reasons might be. So we're doing some case studies there. So that's kind of a work in progress. With regard to sort of we also have emotional literacy support assistants now in all of our schools, and they often, through our supervision with them, which we do half-termly, they do often work with children who there are difficulties with attendance, usually because of kind of well-being type of needs. And so obviously that's an ongoing thing that we support our ELSAs with.
And I think just to say as well, another outcome of that project is, as well as looking for things that work, we're trying to identify if there are things that don't work and if there are barriers, and trying to be consistent with advice to schools on how best to support when children are, or parents are saying that children are too anxious to come to school.
Well, one of the other things, I guess, in terms of our direction of travel as a directorate, and I guess, by virtue of the fact that we've got two scrutiny committees joined up here today, since we've formed as a Children and Families Directorate, we're able to sort of, I guess, join up services a little bit better as well, to provide, I guess, more of a triangulated service to children and young people. And one of the things we do collectively within the Directorate as both service areas is look at the data that tells us around, children who may be looked after, who may be excluded, where there may be attendance issues as well. So we're able to join up those services a lot better as well than perhaps we would have done, say, 2 or 3 years ago before that directorate formation.
Another thing that is new this term, those children that have not been attending because of emotional and mental health difficulties, think about how can we reintegrate them back into a mainstream school. So we shared guidance with all the secondary schools about how potentially to structure that. So it's initially using some online learning, plus also coming in for part of a day. But we want to be really clear that the online learning is not the final step. We want children back into school because we think that's where their social skills can be best developed, where they get the best outcomes. So there's a new programme that, like I say, the secondaries are starting now. So it's a degree of online learning, some perhaps post-school tuition in school. Sorry, not once school is closed, the children are coming in just to get back on the site, with the view that they would then start to come in when all children are there. They would increase their hours, because we don't want to just lose those children that are already out of school. How do we reintegrate?
Could we have an update on the project then as it is going along to see the impact of it?
Thank you. Any other comments? Oh, sorry.
Yeah, from health and kind of the discussion around sort of integrating up the responses. I'm sure you're familiar with the School in Reach project from CAMS, which is part of the whole school approach. So we have, apart from some vacancies, in the whole of Gwent, all secondary schools and primary schools have a CAMS practitioner who can speak to all those looking after the well-being and mental health of children. So we are picking up not only sort of the emotional non-attenders, but then we can signpost in if they need. Obviously, there's the school counselling that's there and the initiatives that are being described. But we've got our primary CAMS, which is our sort of upstream early intervention, really, for what previously we'd have thought of as lower level problems. But I do know that a high proportion are non-attenders. And so we join up with what's going on in the schools for that. And some of those in the more specialist teams within CAMS, non-attendance is an issue as well. And kind of really close integrative working is kind of what we find that's working really well. So there is it feels a lot more joined up than it has in a few years ago.
I was just going to add about the counselling service as well. The school-based counselling service is externally commissioned. We oversee the contract monitoring for that, and they do offer out-of-school sessions. So we give services to every school, but there's also out-of-school sessions that are held in CCYP, and they're really well used. They're always full, those slots. So they run some of those over the holidays, and any children can come to those in the evenings if they don't want to attend in school time.
That takes us to question 3, and it's relating to 4.1 in the report. Councillor Alan Slade, this is your question.
Thank you, Chair. Have Estyn and Healthcare Inspectorate Wales reviewed the action plan set out in Appendix 1, which sets out the actions provided against each of the 11 recommendations, and who will be responsible for monitoring progress against those actions?
That will be picked up by the Children and Families Partnership Board. So that's chaired by the Director for Monmouthshire County Council and is co-chaired by a senior representative from the Health Board. So that action plan is monitored and reviewed through the Children and Family Partnership Board, which then feeds into the Regional Partnership Board.
And that'll be monitored on a regional-wide basis, Councillor. Obviously, we'll be monitoring individually from Torfaen perspective as well, how we're achieving against the action plan.
Thank you.
Thank you, Alan. Takes us to question 4, which is 4.11 in the report, and Victoria Hall to ask this one.
Thank you, Chair. So my question is, the response states that the space wellbeing panels work well but are under high demand. Could you provide further clarity around what working well means in practice, and whether children are getting the correct support from the correct services in a timely manner?
Do we start, and then there'll be others can come in. But the space wellbeing panels have been invested in by lots of agencies, but the Health Board have committed to the coordinators who are they've taken steps over the last few years since it all began to kind of streamline the process, and so children and families aren't waiting unnecessarily. So we've got, for example, pre-allocation processes where sort of CAMS gatekeepers would be there to kind of identify one of the teams in the integrated CAMS system that we've got, that they come straight in. Those where we need to gather more information, again, that's been streamlined by sort of initiatives, so children and families aren't waiting, but they can give their information in. And then the panel discussion, which is quite unique across Wales, that had to have actually a panel of social care services, healthcare, third sector, actually sitting around with good information to kind of decide exactly what children and young people need. There used to be if one service was involved, the other services can't be. That's been gone away with. So actually, if a sort of network or sort of a plan, a package of care, and those agencies work closely together. So, and it's a single point. So some of the referrers, it was an ever-changing sort of minefield of where to kind of send. It's just the one place now, and it's self-referral, and that's again a unique, fairly unique across Wales to actually for self-referrals to be able to be made and accepted. And there's each service has its kind of preferred thresholds, but actually nobody gets told no. There used to be an issue of actually people being bounced around, and so the no wrong door principle is really embedded in the space wellbeing panels. So yeah, numbers are high, demand is high, but I think there's a confidence around all partners that we're not missing the children that we perhaps did, that they were somehow invisible to the system, but that they will now get, then, and it'd be a very clear unmet need if it isn't available or a service can't deliver. But yes, so big numbers, but I think generally children are getting to where they need to be.
I think, in order to kind of think about the success of space wellbeing, we probably need to consider what was happening prior to space wellbeing. So pre the launch of space wellbeing in 2019, you'd have GPs and other professionals referring directly to CAMS for support, and there would have been a need for that individual, if they weren't referring to CAMS, to understand all of the services and support that was available out there that wasn't, below CAMS, in order to determine where they referred that individual to. What that meant then is that there was a high proportion of referrals that were going direct to CAMS that didn't meet the CAMS threshold, and then were kind of bouncing back then to the beginning. So that child or young person wouldn't necessarily be receiving a service to meet their needs. So I think the real success of space wellbeing is that GPs, professionals and individual parents, carers, etc. can refer into the panel, and then you've got all those individuals, including CAMS, sitting around the table to determine the most appropriate support for that child or young person, so they're getting that support at a much earlier stage than they would have had done prior to Space Wellbeing existing.
Can I just add to that? I agree with all the points that everybody said, but I still think there's a need that is unmet in a timely way, especially for children involved with children's services. So there are still, you know, children can get seen in families now, and I do think all those things stand, but I do believe, and I see in our practice day to day, that there's a lot of unmet need as well. Post-COVID, we've seen you know, an exponential rise in kind of mental health needs of children and what they experienced through the pandemic. That's had a massive kind of, so we see a lot more referrals. I think, you know, just want to say on the ground, I think families still do struggle to access timely responses. And also in my area of, you know, experience and expertise with children involved with children's services and care experienced children, if they also move out of Gwent, you know, which is a part of an issue, we're very fortunate within Gwent to have the range of health provision that we have got. That's not always the same across Wales, so it's important for children who obviously, you know, placement stability and all those things come into it. But yeah, just wanted to say I still think there are a lot of families who struggle to get a timely response to their needs.
Yeah, I think that came over in our visit as well, didn't it? Yes. Any further comments? Oh, Jackie.
Sorry, just to pick up on what Jenny was saying as well, I think in the report it's what's referred to as the missing middle. So I think with Space Wellbeing Panel, we've got CAMS there, we've got a number of early intervention and preventative type support services that are available, but there's a gap in the middle, so the missing middle in terms of children and young people who don't quite meet the threshold for CAMS, but actually they're beyond, their needs are beyond that, which can be supported by those early intervention services. And I think what then happens is that creates pressure in the system in terms of services like MIST, for example, where lots of our social workers would want more of MIST for our children and young people, but obviously it's a limited resource. So I think that's the area that we struggle with is the children and young people who sit between those two services then.
I agree with what Jacqueline and Jen has said, but I think there are also positives there in regards of the weekly panel means that, you know, that there is timely review of referrals, but in the main for me it prevents that duplication of support. So you have so many services around that table, we don't have that restarting of support because we have information coming from all angles. So we can, you know, within that panel, they're able to discuss whether support has been implemented from one service already, whether it's been successful or not, rather than sitting in an ill-informed panel that start the ball rolling again and not actually give the support that's required. So it's really positive. You see the huge amount of services that are involved there. I think that's one of the key aspects of how successful it can be.
Just to go back on a point Jenny raised around children that move out of county, more often than not, they're the children who we have with the highest level of need and the highest level of complexity, and that is a concern when that service almost stops based upon on a border. It's a national issue. It's not just a Gwent-wide issue. It's a national issue. Obviously, one of the things we're trying to mitigate, or one of the things we're trying to do to mitigate against that, is build up our own residential stock, which members will be aware of within the local authority area, so that children with complex needs will require residential care within the area. However, there is still that real issue that when they move out of the area, the services don't always follow them and become very fragmented, and that's that's a real issue that we really try to address, but it becomes a challenge.
Just to give an example where that was an issue, but through the partnership working with our health colleagues, we've managed to address that. So for some of our really high need young people, where we've struggled to identify residential provision. We've had a young person in Bridgend, significant distance away from us. Our ISET team from Health continue to work with that young person and the family, and the input there had a huge impact on the success of that care plan. So if we had had to start again following that move to Bridgend, it would have been catastrophic for that young person. But the commitment of Anira and Bevan in saying, actually, no, we've started this process, we see that level of need, we'll continue to work with this family. It was the difference between that young person being able to progress and potentially moving back to, you know, a really difficult situation. So there are examples of where we've been able to, you know, work through those barriers together to ensure that, you know, the best interests of our children and families are met.
Apologies. The next two questions are Councillor Watkins, and they relate to 4.15, 4.17 and 4.111. Councillor Watkins, please.
Thank you. So with regards to the actions under paragraph 4.15 and 4.17, how are these being monitored and when do we expect to see some results?
In terms of the broader monitoring, Councillor, as Jacqueline pointed out just now, they're monitored through the Children and Person Partnership that exists across the region, so monitored at the strategic level there. Again, locally, we'll be monitoring the progress made against those at the local level as well. In terms of when we expect to see increased outcomes, there's a, I guess it's how long this piece of string is a broad answer. I don't know if anybody's got any other more specific answers to that.
I mean, I think just to reflect on an operational level, I think we're really quite far on in our partnership arrangements. So lots of children get discussed through partnership panels, forums, steering, you know, we've got lots of forums to do that, which I think does really improve the outcomes for kids. I think Claire's mentioned, and Mark, previously kids would get referred to lots of different services, and there was that kind of lack of coordination and lack of kind of joining up around what their needs might be, and I think that's really been addressed. So we see lots of more positive outcomes for kids in terms of operationally how we get together and hold their needs together as a collective group, and I think that happens quite regularly now. I think joined up working is much more advanced than it was. You know, I think missed probably 24 years now since this started, and some of you around the table have been on that journey with us from the beginning. People weren't joined up. They didn't joining up meant filling in a referral form and passing that to another agency. There wasn't a dialogue or conversation about children's needs, whereas now there are lots of different forums within this borough and across Gwent where we join, and we kind of think together with our colleagues about which service is the best to meet those children's needs. So I think there's lots of examples, and I think that's led to lots of improved outcomes for children across this borough in terms of us being able to improve their mental health and well-being.
We've been having discussions recently in various forums with schools about the early intervention prevention hub. So I know that's a relatively recent development, but the conversations we've been having is where perhaps families are waiting for support. Obviously, schools are sometimes trying to work with those families and meet that need. So the idea, isn't it, of that early intervention prevention hub is that there are not multiple referrals going in through various pathways, but that sort of triage system can happen there. So I still think there's work to do because that's still fairly early in its implementation. But the communication with schools is regular in trying to get that one point of access so that, as I said, schools are not referring to multiple pathways as well, so that we've got that better joiner.
Yeah, and it seems to me, there has been a significant change in the ways, in terms of joining up space well-being with the kind of understanding and the connections between health, social care, and schools. But and I think one of the things from the past that is no longer the case is there used to be just some highly specialised teams within CAMS, and then a sort of gap of an absence of sort of services. And I know we're talking about the missing middle, and I'd sort of like to suggest that actually I think the middle is there, it just doesn't have the capacity, because we now are so much better at detecting the demand, and it is for all sorts of reasons very high. Certainly CAMS now, because I referenced this in the integrated CAMS are sort of 20 teams, and there is no sort of lower threshold to get in. It's just that each of the teams are very full, and each of the other initiatives that we've talked about that are kind of there to meet the need are really full. So we've had that a number of times in space wellbeing panel discussions, that there were waiting lists for us, there were waiting lists for the third sector, you know, the services being full. So there will be some specific services not available, but I think mostly they are, but they're just really full. It's a capacity-demand mismatch. And certainly the old kind of ideas that CAMS, you can never get into them because they really gatekeep. And that was the case, but we have expanded upstream, if you like. And so that isn't the issue, but it's all together. But through Join Up, we do it better, and I think people are signposted where they need to be better. But it is absolutely true that people are waiting too long, and that's a big part of what I'm dealing with, is trying to recover and get us to a point where the capacity in a timely way can meet the demand. But more confidence that we're not missing great big, this cohort of young people are just getting, there's nothing available for them. They're waiting. They're waiting for something that is, going to meet their needs potentially, but it's a too long wait. Often.
You'll see in the report that there are a number of different forums that we hold here in Torvine that ensure that we have that multi-agency approach. So as Jen discussed, we have the missed steering group, where we discuss all of the young people who have that additional level of need, and then we prioritise our own support. We also have the complex needs panel, which has health representation. So we have someone from CAMS who attends, and it wouldn't necessarily have to be children who are receiving support from CAMS. They can provide advice on alternative services and support us in signposting to services. So all of our young people that are assessed to have complex needs are discussed on a rolling basis, and that's managed by our head of service to ensure that there's care plan progression and there's accountability. For our children who have really complex needs, in some situations we're holding weekly multidisciplinary team meetings, and in those sessions we'll have a number of health representatives. So we may have someone from CAMS, someone from Forensic CAMS, someone from the ISET team. We'll also have education, of course, placement providers. A really, robust meeting where we're monitoring care plan progression and we're pulling on expertise from different areas. So where there are those missing parts, if you like, or we know that CAMS can be fantastic, but a lot of our children really struggle to engage with professionals. And so we try to manage that from a multidisciplinary perspective. You'll see that all of our fostering team, or our placement team, are trained in trauma-informed or the circle of security to support our foster parents to care in a therapeutic way. All of our social workers will be trained in trauma-informed practice so that we can engage with those young people in a trauma-informed way. So we're trying our best to ensure that, we're supporting our young people as effectively as possible. And the multidisciplinary working, currently, I would say is, at a good level. There are still those missing bits, but I think we're all working really well together to try and address that.
Okay, so moving on to paragraph 4.1.11, can you provide more detail around the option of health representation in safeguarding hubs and how this might help drive improvement?
Sorry, Councillor Watkins, can you just confirm the paragraph number, because the paragraph number is not corresponding?
Yeah, 4.1.11. It says establish comprehensive information sharing agreements across. And actually, across what, I don't know, because obviously that was missing. And then the response is information sharing protocols and WASPs are in place, but the action is to explore the option of health representation in safeguarding hubs.
So that's...
Jacqueline, I think the number is wrong on the report, so yeah, 411.
That's referring to the regional safeguarding hubs. So there are 2 in Gwent, and at the moment there's police representation in there, but there isn't health representation directly in the hubs. So that action there was around exploring, could we have health representation directly in the safeguarding hubs? And again, I think there's a willingness there to explore, but it's more about capacity to be able to offer an individual to sit in those hubs. But there are effective information sharing protocols in place that mean that we can get the information that we need in a timely manner, but obviously the ideal would be to have professionals there actually sitting within the hubs.
So is that something you're going to continue to explore? Should you get the capacity? It's always going to be on the table, but yeah.
Absolutely, yeah.
That takes us to question 7, related to 4.2, and it's Councillor Williams.
Thank you very much, Chair. Sorry. This is around 4.2. In fact, a lot of what my question was about has already been answered, because it was bearing in mind that this report is about how joined up things are, and in fact your answers have already said, an awful lot about how much things are joined up. I guess what I'd like to perhaps focus on is 4.2. 4.2.1. It's really good to understand a bit more how the kind of collaboration between the CAMS referrals and the neurodiverse referrals are done. Are you happy that information about waiting lists is shared with the relevant schools? I simply ask that question because following our visit, we had the impression from staff that sometimes that information is lacking. So just a little bit about how that kind of cascades across the schools.
Okay. Sorry. Firstly, the neurodevelopmental pathway is part of CAMS. They're not separate, so we are very much that there can be external referrals coming in through initially space well-being, and at the same time as recovering. And I was saying we're trying to recover in lots of different ways. We have recovered in terms of being able to hit the targets for neurodevelopmental. So we are seeing all children referred for an assessment within 6 months, and it's all being completed in a sort of timely way once it starts. That we're the only area in Wales to hit that target, and the others are nowhere near. And so we have that recovered, but at the same time we've been transforming that particular pathway. So there is an early support hub which has got an innovative kind of way of thinking about neurodiversity and the developmental issues. So on a sort of 9-dimension measure, which comes from Portsmouth, but it looks at the kind of things that ASD and ADHD kind of describe, but also far broader than that. So there will be this, we're sort of front dooring capacity in a sense, so expertise can kind of look at the referrals. There are other people sitting waiting for a diagnostic assessment. If that's really not going to be the best outcome, they will get a profile, a developmental profile, which will be highly useful for an advice and guidance at that early stage, so people are not having to wait. So they get this detailed sort of triage of the information, and that goes back to schools for them to inform of the sort of the support plans and for parents. And so when those cases, we hope, were only the cases that really do need the diagnostic assessment. By the time that happens, there'll be fewer people waiting. At the moment, there's just lots of people waiting for that sort of golden ticket diagnostic assessment, and probably it's about half of them aren't getting the diagnosis because they don't need to be sitting there. So that's happening. In terms of informing the schools, a big part of the pathway is the school in-reach practitioners who connect in and linking with schools. But in terms of actually all the information about how long the waits are, we could probably be better at handling that information through the schools.
In terms of how education sort of link in with that, there is an ASD support officer who works part-time in the education team and also sits in what was Families First. So she maintains a caseload list as well, so she's notified of any new diagnoses and will then link in with schools. But we did pick up in the summer term that there was a lag between her being informed of some of those, whether the child was under 5 or over 5. And my understanding from liaison with the DECLO, our designated contact in health, was that they are managed by 2 different teams. So we were seeing referrals being notified in different age groups. So when we raised that, a conversation was had, and then that improved. So what we've talked to our ALNCOs about, our additional learning needs coordinators, through our forum with them, is that if they are being made aware of referrals and or diagnoses, to link in with the ASD support officer so we can triangulate and make sure our information sharing is as tight as it can be. But also, we're not a diagnosis-led support service, so you know, it should be needs-led. So we've also identified, because the rate of diagnosis has increased in our schools, we've talked previously to this committee about the Autism and Education Trust professional learning. We met with ALNCOs yesterday. We are establishing a champion group of trainers now, so we can start rolling out that awareness training for all, whether you have a diagnosis or not. If the needs are presenting, that schools have got the tools to meet the children's needs. But we are aware of that lag, and as I said, it was picked up immediately, and the DECLO was really responsive to that.
That's really helpful, thank you.
We've had enough information on CAMS, but we've got another couple of questions on CAMS. So, Councillor Alansley, I think your question's been answered, unless you've got anything else to add.
No, I'll ask it, but yeah, I think it probably has been answered. It refers to paragraph 4.2, and how are we supporting children and families whilst they're waiting for CAMS assessments or treatment?
In terms of the first assessment, which we call within our system a choice, so it's a kind of non-medicalised kind of, it's when the first encounter happens. If it's a pending emergency or it's a crisis presentation, it's within the same day that can happen. So there's no delays, and all of the other teams, apart from we've been talking about the neurodevelopmental, that first response is within a month, and that's the sort of target. But so we're able to sort of do that within a month, which we still don't feel is it quick enough. It's not responsive enough. And there is an initiative that the NHS executive is pushing for all of mental health services to be open access and more flexible. And with all the sort of changes we've been talking about, single point and self-referral, and trying to be responsible and working directly and indirectly with partners, we're kind of on our way to some of these principles. But we're going to be a pilot site within integrated camps, potentially, and we're working on that. And I'm sort of just remodelling the front door a little bit. And the sort of phrase that I've come up with is front dooring the capacity, that we could try and give same day access for people, whether it's an emergency or not. And we have the capacity to see people within a month. But if we can try and push that towards the front door, we can start the process and having a more sort of like therapeutic rather than a sort of triage assessment, and then it's signposting on to the next phase of someone's interventions. But so that's an initiative that we could keep you informed about, is if we can do it even more accessible, even more flexible. So we're working on it. Unfortunately, there are internal waits. So those front door waits are not as bad as they used to be, but the internal waits for some of the teams are unacceptably long. And helping them safely wait, we do have a consultation line that we've started running, and actually that's available to anybody who is open to CAMS, any of the teams. But that is one of those issues that I mentioned earlier. We don't currently have the full capacity to meet all of the demand, and so people are waiting, not for that initial assessment so much, but for the ongoing therapy and the ongoing kind of work.
Sorry. Councillor Slade, you're happy with that?
Yeah, yes, thank you.
I just wanted a supplementary. You mentioned capacity. Is that financial capacity? It can be both finance and staff, but where is that?
Well, yeah, it's we just don't have enough staff. I mean, we're looking where efficiency gains and where we can kind of be keep the quality but improve quantity. So we're looking at all of those things, but really there just aren't enough staff. And so if money comes, I mean, our service is all about staff, really. So if money comes along, we're not an inpatient service, it would be more staff. But there isn't any money at the moment.
Thank you. That takes us to question 9, 4.31. Councillor Mark Jones, I don't know whether we've had your answer to your question, but feel free to answer.
Right, so anyway, good morning all. In a report you said CAMS implements early intervention. How is this done, and is there any examples you could provide, please?
Sorry. So I think a lot of the early intervention work partners are delivering, and we're back to the sort of the idea of the panel, and so finding where the fit is best. But it isn't hard to get into CAMS now. We do have we have to be compliant with the mental health measure, where part 1 are the brief intervention work for those with mild to moderate mental health difficulties, and then the part 2 work, which is for those with more complex, moderate to severe problems. And so we sort of have to kind of make a distinction, but we have quite a lot of part 1 teams. We have the school in-reach team, which we've talked about. We have a primary CAMS, which offer sort of 6-session groups, brief interventions, which connect in with school counselling and some of the third sector. And so that is offered. There were big waits for both the initial appointment, that choice, and then that partnership follow-up. But we managed to hit that target, so it's a month to start the work, and to be seen, and then a month to start the work, and we are hitting that target. So that was another successful recovery plan. So that is happening. We also have what we call a community embedded team, which is kind of experienced staff who are working with partners, actually, through consultation, signposting, and sort of. And that is something that we're kind of trying to improve the overall capacity of the area by letting expertise reach out, if you like. So they're not necessarily leading on a case, but they are supporting someone else to do that. And we have lots of examples. So that community embedded team does a lot of strengthening of the system around that family. Does lots of consultation. We have, there's PIMS, which is the Parent Infant Mental Health Service, which is, again, strengthening and working with practitioners who are working with families in need. We've got the drug and alcohol team who, again, do a lot of consultation, indirect work as well as direct work. We've got forensic CAMS who works through the YOSAs. And we have access to our kind of emergency liaison team when there's risk. So, and they can be contacted as a duty phone. So if a school counsellor is working with someone self-harming, they can call and get some advice around risk management. So we're sort of reaching out, I think, and so that's hopefully providing capacity and informed working for everyone else, even when we're not directly doing that work ourselves.
Can I just add to that as well? I think when we're thinking about early intervention, it's not just around health-led mental health interventions. I think there's reference later on to the Welsh Government framework around NEST. And I think it's broadening out the kind of, not the definitions as such, but the support that mental health is everybody's business, isn't it? So not just looking to CAMS, some of the determinants of mental health are around poverty and, you know, access to education and opportunity and, you know, some of the basic things in life that families really struggle with. So just knowing that all those things that we need to sort of broaden out if we're thinking of early intervention and help, of how we support families to get some of those things in place. Like some of our youth services are incredible at meeting some of the needs. So really early intervention needs to come from everybody, not just looking for help, because I think otherwise we get that kind of, that they're the only people that can deal with mental health, whereas it's so much wider than that. And, you know, Welsh Government have been trying with their sort of strategic direction around NEST and some of the other sort of trauma-informed Wales to broaden out that whole definition of how we view mental health and how we support children.
Something that we've also been doing recently is promoting the work of the Cynefin team. So they've come to speak to head teachers in the last month, for example. We've sent out information about that whole school approach to wellbeing offer that the Cynefin team, which you know, are linked to health, can offer to schools. So they've had quite a few plugs at various meetings recently. Didn't know if you wanted to say anything about the whole school approach to wellbeing, Sally.
Yeah, I was just going to add. So we've in the local authority we've got a health promotion schools practitioner. It's funded by health as well. So she works with all of our schools at that more preventative level around the whole school approach, the whole school approach audit, making sure that schools and systems are clear about where the gaps are in their provision and what they can do to plug those, or what services they can draw on. As well, there's the Shern survey. I think this is mentioned somewhere in the report as well, but I know it's not directly related to CAMS here, but the Shern survey is carried out with young people in schools to try and identify what they actually feel are issues in their own well-being. So something, for example, that came up in the last survey was around sleep, children not going to bed early enough, and about vaping. So then we can work with partners to try and help schools to address those things. So we had, for example, Ash Wales came in to do some training around vaping. Our Healthy Schools practitioner can do some work with the cluster then to start thinking about how do we promote, for example, better sleep patterns. So things are picked up through those surveys as well, and there is that early intervention through schools.
Just ask a question. I'm not familiar with the terminology that you used. I know that education use a language of their own and algorithms to understand. Use some scheme.
Yeah, the team have renamed themselves the Cynefin team, which is a Welsh translation. It means sort of belonging and community. Is Welsh, the Welsh word, Cynefin. But they were previously, and looking at you, Mark, the Gwent Whole School Approach to Wellbeing team, and they've just renamed themselves Cynefin because the idea is that the school is a community wider than just the children and the staff in it, and everyone should belong to that community. So that's the literal translation of that word, Cynefin.
Question 10, which is 4.3.3, and it's Councillor Janet Jones.
Thank you, Chair. My question is related to 4.3.3. The report states that CAMS doesn't have a remit or specialist training to provide post-diagnostic support, as a result, children are referred to the more specialist teams within CAMS, to ensure their needs are met holistically. Is there sufficient capacity in place to support this, and what, if any, is lacking in the role to support our children and young people?
Yeah, I think we touched on this earlier about when there is a diagnosis. We're hoping that the transformations of what we're calling the NESH, that's the early support hub, will will, you know, so it will be, you know, education isn't a diagnostic system, but it just seems that there is a real sort of fixation with the idea of diagnosis, and of course they can be useful when appropriately kind of given. But there is some support after a diagnostic assessment in terms of feedback, and there are some fledgling groups that are kind of run by health, but they're also run by, I think you described that there is a connection into support, specialist support in schools to kind of help make the adjustments. I think the PCAMS is our primary CAMS. We do find that actually as a sort of comorbidity that neurodiversity is a part of lots of presentations, which is actually not the primary reason for somebody being referred, and our primary CAMS team doing those brief interventions, it is part of it, and it turns out that you know, our community embedded team, which is another one of our sort of early intervention teams, a lot of it is in complex situations, helping with the adjustments for the family and in the wider community. So that work is there. It is a demand, but there's not quite enough in terms of I think across all partner agencies that health, we've been particularly commissioned to do the assessments and try to kind of make that, but the team are desperate to be doing more intervention, but at the moment the demand on doing the assessments is just so high.
I'll come in again like Rose. Is this a financial restraint?
And I referred earlier to our ASD support officer, Cheryl Deneen, so I think that's where some of the support is picked up then with schools, and that's why the triangulation of that list of children who had received a diagnosis was really important to us, because it doesn't mean that they wouldn't receive support in school without that, but what it does mean is that our ASD support officer works alongside one of the education psychologists. They then reach out to families within a matter of weeks where a new diagnosis has been received, and will offer a meeting, support, signpost to other resources. They offer parenting courses. They've undergone training themselves in the last 12 months, which they update regularly. It used to be that contact would be made within 2 weeks and a meeting with the family arranged. The rise in the rate of diagnosis means that isn't a feasible, sustainable way of working. So the offer now is that contact is made within 2 to 4 weeks, and then the family is offered a pathway that suits them best, because sometimes families don't want or need that meeting, especially if they've had another child with a diagnosis, for example, but they've got the offer of that, and then they've got signposts onto training and areas of support. And local groups as well, such as Hope GB. Cheryl has put together a fact sheet, if you like, of local support avenues in Torfaen that she can signpost families to. So it's quite bespoke.
The next question is question 11, Councillor Watkins.
Thank you. So moving on to paragraph 4.4.1, a referral to treatment, RTT, in Wales is measured from the point the referral is received, not when it's made by the GP or other professional. Does this make much of a difference? And if so, what's being done to mitigate it?
It used to, because it would take a long time to administratively be processed. But as I said, we've invested in the coordinators who do a brilliant job across the whole of Gwent. But they are really quick, and there's a constant sort of quality improvement plan to kind of make sure it all happens quicker. So there isn't a massive delay now. So the information is gathered really quickly. The referrals come in. So it's a matter of a day or two, whereas it was probably being delayed by a few weeks when things were inefficiently done.
Okay, thank you. Yeah, that's good to hear.
Takes us to question 12, John Cunningham.
Have waiting times improved since the new development pathway was redesigned in April 2025?
not because of the redesign. We've done well with the hitting the target and bringing our kind of waiting time down, but that was based on a big waiting list initiative and some work with the under 5 pathway, which is slightly different because the children are younger, and paediatrics and speech and language therapy have to play their part in that. But we brought all those things together. We managed to hit the targets. The bit that's coming in is the transformational bit, which is looking at development in a different way and trying to provide early support. We haven't, in terms of the waiting times, ultimately, this is going to be helpful, but we're still dealing with the legacy of high referral rates. So, in fact, we've had a blip, and I've got to start going in on Saturdays as well to start doing the waiting list initiative just to bring it down again. But no, I can't say that it is improved waiting times yet, but I think it's improving the experience of people. It's been designed in co-production ways, so that lots of families and I think schools have been part of those co-production events. I think people are excited about it, and I think it will make a difference to people's experience, and ultimately we hope it'll lead to improved waiting times. But at the moment they're about the same as they were, and we're still having to do lots of assessments at the same time as initiating, which are going well, these early support hubs.
Yeah. Councillor Williams. Question 2.
Thank you very much. This is still in relation to 4.2, 4.42 and 4.43. Just to understand, so given that this is a sort of from birth to 18 referral, the neurodiverse pathway, how effectively is this linking to the early years service and things like the health visiting service?
The details of the health service. I don't.
Are you understanding the question?
No, I'm understanding it, but in terms of I don't oversee the health visiting side of things, so that bit of the pathway right. I won't be so familiar with, but I do know that the NESH, the early part, we've been dealing with the under 5 pathways, which connect in with the other pathways for early intervention within paediatrics and speech and language therapy and health visiting. So I know those links, those connections have improved as a result of the changes, but I don't know if anyone else is better placed to talk about the...
Would you just repeating the question?
So, basically understanding how this pathway links to the whole early years service, so like the hub in, is it Lankelin? Yeah, so for instance, the hub in Lankelin where it's an early years, because I guess if the pathway starts from, you know, all across the range, that can just to understand how that connection works, or if it does work. And that would include health visiting and, you know, all that kind of intervention at that point.
I think probably the best way to front
families first, you know, sort of interventions, all that kind of connection.
I think it's probably easier for me to ask Charlotte Dickens to give us an update that we can bring. So Charlotte's our early years manager, because otherwise we'd probably give you half a story here. Okay.
What I was going to say is when I mentioned the discrepancies that we were experiencing in the data, not discrepancies, but a lag, the under 5s were the ones that we were getting timely information on. It was children that were over 5 that we were experiencing a delay in. But as Andrew said, Charlotte sort of oversees that team and would be better placed, I think, to give us the fuller picture on that. But in terms of a data sharing point of view, we felt we were getting that data in a really timely manner in terms of new diagnoses.
Thank you for that. That takes us to the education part of the report, question 14, which is Councillor Mark Jones.
Thank you, Chair. The report states that all schools in Torvine are invited and encouraged to complete the School Health Research Network survey. Could you confirm the participation levels from the schools, please?
So every 2 years they do the assurance survey with our secondaries, and they've introduced it last year for primaries as well. Schools do sign up for it and then administer it through the course of the term that it needs to be administered in. The current one that we've got this term has been 100% sign up for. They've got until the end of the term to actually administer and complete the survey. So at this stage, we don't know how many of the schools will, but the fact that they've all signed up, once they've signed up, they are committed to administering the survey in that term.
Okay, lovely. Thanks. Obviously, it's a number then that can be given at a later date.
We'll have a report back on that survey, yes. Question 16, Councillor Gerald Jones.
Okay, thanks, Chair. Question 15 refers to the offer from the Torfaen Young People's Counselling Service as an out-of-school service at the Cwmbran Centre for young people. Has this been effective? Have there been any issues, particularly around transport? And if so, how have these issues been managed?
So the out-of-school service, is provided down at the CCYP. Regarding transport, it would be for people to make their own arrangements, so the schools wouldn't arrange that. It would be a case that if young people wanted to attend a session outside of their school hours, because they are in the evening, either a parent or a young person could make their own way there. I think that the point of that also is that sometimes young people don't want their families to know that they're going, so you know they would need to kind of get there themselves. What was the other part of the question?
Just to say, how have these issues been managed, but you've addressed them. My concern is, because I'm from the north of the borough, not everybody wants to come down or access the south of the borough. So would consideration be given to providing the service, maybe on a monthly basis, somewhere up north?
Definitely. I think this is something that I've discussed with the school counselling service recently. So pre-COVID, we used to also make use of the libraries in the north to make those sessions available out of school. And then since that time, that hasn't happened as easily. But I think because we're now seeing that the demand for the out-of-school service is increasing, that is something that I did speak to the counselling service about. I'll put it back on the agenda and see if they've been able to find a setting. And
that's really appreciated. Thanks very much.
Alison, could you just talk about online support that's available, plus also the in-school support? You know, because there's other organisations that offer counselling service as well, thinking like Childline, etc.
Yeah. Obviously, there are other counselling services available. I only oversee the school-based counselling service contract, so it's only that I only know the data about the children that have accessed that provision. For example, other settings, so the college Gwent have got their own counsellor, although I understand from my conversation yesterday that that person has recently left post. So we've seen a lot of young people that would have previously seen the counsellor in college Gwent coming over to the out-of-school service as well, which is increasing demand on that aspect of things. With the counselling service, once they've reached the point of, they don't maintain a waiting list that just keeps getting added to, because that would mean that young people were then left without a service for long periods of time. So once a school counsellor has got a waiting list of 20 young people on the waiting list, at that point the waiting lists are closed and schools are asked to signpost those young people to other services, whether that's online or platform is another one I think that families first refer to, so that they're not just left waiting for really long periods of time.
Thank you. Continue to keep on our agenda, please, Chair.
Thank you. In terms of the question about how we monitor the effectiveness of it, so Alison has a regular monitoring and evaluation report that she brings to our education leadership team, and there's a measure in there about the young person's perception of the difference that the sessions have made. And that's something I think it's an annual review that we complete, isn't it? Because we want to make sure the service is effective. And We've also talked about the waiting lists and the demand for the service, so it is something we keep under regular review.
Thanks, Jay. Thanks, Andrew.
Thank you. That takes us to question 16, and Councillor Collett Thomas.
Chair. My question is for paragraph 5.5. How many educational psychologists do we have within Torvine? And do we consult with schools to see how satisfied they are with the service and support we provide them?
Okay, so currently in Torvine we have 6 educational psychologists. That's the number of people, but it equates to 3.62 full-time equivalents. So, and they cover early years, all schools and post-16 settings. So quite a small team. And we've also got some educational psychology service time allocated to the youth service and to the early intervention hub. One of our EPs works part of her time there. In terms of sort of satisfaction, yes, we do sort of annual requests around. We actually have a joint meeting with schools rather than just ask them to fill in a satisfaction survey, which often, you know, it doesn't tell us everything that we need to know. At the end of every year, we do an evaluation with us, every school. Their link EP does an evaluation where they'll talk about all the things that have worked well from both points of view that year and things that maybe we can work on for next year. So it's a bit more of a joint dialogue and conversation rather than just receiving scores and, you know, then having to go back and have that conversation. We do evaluate our service, and I can give you reports from previous years for that if it's interesting or useful, but it's mainly this evaluative meeting that we have at the end of the year where we can talk about how the year has gone and then start to think about how we might work differently or carry on in the same way in the next year. We a couple of years ago we got rid of our time allocation model. So previously we'd had a time allocation model that used a formula to work out how much time schools, EP time schools would have. And we felt that this was quite constraining at times. So often we were finding that schools were asking for much more of our time and we were giving them more if we could. And sometimes we had schools not really needing our time, but finding cases for us, which we didn't want to do either. So now we're in a position where we give all schools two visits a term, and then that's everybody, and then you just request as much time as you need. And what we're finding is that our schools actually do get a huge amount of EP time. Our secondary schools, I did some summarising the other day, we allocate in hours, and they are getting a high number of hours of EP time a year in terms of individual contact for consultations, even to the point where one of our schools is saying, oh, I've come from another borough and I'm not used to this amount of EP time. I don't quite know how I'm going to use it. So obviously we'll work with her to work that out. But I think generally satisfaction with the service is really high. They've all been really asking for us to do this ELSA intervention that we're now doing with schools that all of them are really positive about, and that's been really well evaluated. We've evaluated the impact of that at the end of last year, which was the first year, the pilot year that we did it.
The other thing that we do as an education service is the annual head teacher survey, or satisfaction survey, and all throughout the year last year at ALNCO Forum we would issue a Microsoft Form survey at each forum to try and pick up any issues, and then we issue a sort of you said we did in response to the annual head teacher survey, and that survey in terms of ALM as a whole was quite positive. There were some issues that we responded to.
So do you think that we're managing to cope with the demand, or is there need for more staff in the department? Should go to the director, shouldn't
More money is always welcome. Yeah, we've increased the capacity of the wider ALN team this year because Ed's like to have a very specific role, and we're really clear on that. But we want to get in to have more holistic support. So Claire's recently recruited 2 ALN wellbeing advisors who are due to start next term. I think we've got 3 extra posts we've got this year, and we've changed the funding formula for schools so they can carry out more early intervention work. So in terms of their mainstream ALN funding, it's now based on the number of pupils they have, the poverty demographic of the school, plus the number of learners with individual development plans. And that's actually seen a shift of funding from secondaries down into primary schools, which allows them to have this more early intervention work. So we would always want more staff. The demand is significant. But actually, the feedback from schools is that actually this is sufficient and it's being managed appropriately at the moment. There is a challenge within schools about their ALN provision, and we know that is a real challenge for them. But in terms of central services, I feel we're in a good place. Claire?
And it's just to make you aware, there is a vacancy within the team at the moment because the post holder retired in the summer. And Alison and I have been looking at ways of managing that forward and trying to be innovative in terms of future recruitment, not just replacing like for like, but looking at what the need is and how we shape that service, using that vacant post in the right way. It is quite difficult to recruit educational psychologists.
Yeah, there's a national shortage of educational psychologists because they're constrained as to how many they can train each year. So there's only 10 trainees that come from Cardiff University each year. Often they've got jobs already lined up in their second or third, the second year of training, have a 3-year training course. So the recruitment is difficult. When we went out to advert earlier in the year, for a part-time post, we didn't have any applicants. So it is difficult to recruit. That is, but we're looking into pathways of trying to, when we have trainee EPs that work with us, being able to keep them on or advertise those posts in a timely way so that we can get people earlier on in their kind of training journey.
So as I said, the retirement of that post holder has given us that scope to just review.
Yeah.
That. We do have Welsh speaker in our EP team as well.
We do. So full-time Welsh speaking EP, yeah.
Good. That's question 17, and that's Victoria Holder.
Thank you, Chair. My question is in relation to 4.5.7. So members understand from the report that all schools have had one member of staff trained in trauma-informed care. The question is how consistently are schools embedding and delivering the intervention and also being able to provide staff training to colleagues?
Okay, so one of the requirements when schools have a trained TIS practitioner is that they would, one of the requirements of being a practitioner is that there's ongoing supervision procured for that member of staff. When we initially funded the posts, we did request that staff made arrangements for that supervision because it's obviously important for safe practice. But since then, we have actually used grant funding from the Whole School Approach grant again to procure that supervision for our TIS practitioners so that we can make sure that that is happening, because otherwise we were worried that schools might not have the kind of money to pay for that supervision. So through those supervision, we kind of know how many of those schools are still attending supervision, so that is a requirement of practice, and that makes sure that their practice is safe. What was the second part of the question that you asked? Sorry.
So it was about how consistently are schools delivering the intervention and embedding the practice throughout the school. Yeah. And then also, are we able to provide training to colleagues as well?
Yeah, so, sorry, the second part, no. When it's very specific. When you do the TIS practitioner role, it's an 11-day diploma. You can't roll that out to other staff to deliver that intervention, because that becomes potentially, not very robust or safe practice then. So only the person that's done that 11-day diploma can use TIS interventions in schools. Some schools, it is kind of time intensive to have TIS sessions. Some schools have carried on with providing those, but it just depends on the capacities within schools. Sometimes the TIS practitioner is the same as the person who's now trained to be an ELSA, and some of our schools are saying actually, ELSA sessions are you know, we make better use of those than TIS. They don't preclude each other. You can do both, but I would say that the intensive TIS work in schools, it does depend on the capacity of the schools to release that person to continue to do those interventions.
And the other thing, as Alison said, is one tool in the toolbox. It's about culture and approaches in schools. So the work of the health promoting schools practitioner is to ensure schools are doing that whole school approach to wellbeing audit, evaluating their practice, looking at their offer, making sure that they've got a number of tools in the toolbox, if you like, to support children's mental health and wellbeing. And that's another reason why we're really trying to promote the work of the Cynefin team with our schools in Torfaen, because whilst they're not practitioners that will work with children, but they can work with schools to look at their whole school approach to wellbeing, to make sure they're evaluating what's in front of them and providing the right support and interventions depending on the children in that setting, because you know, what's right in one school will look different in another school. So there's lots of tools that schools could be using, and a TISI trauma-informed approach is central to that, but it shouldn't just be about the one practitioner in the school. It should be about the culture across the school.
And we have
That's what the question is alluding to, is that you've trained one member staff, but we're looking for an embedded culture. Yeah.
Sorry, a 2-day, we've given SLT the opportunity to access a 2-day SLT TIS training course, which has been really well attended by all our senior leaders in schools. So that's the culture creating part of it. So while those have been really well attended and really well evaluated, schools have sent different members of SLT. So if staff have left, they've had the opportunity to send somebody else the following year. We've done that annually, and that's where they can make use of that training course to think about their systems in school, think about their relationship policies and the culture that they're embedding.
We've talked in previous scrutiny sessions about IBIS, the Improving Behaviour in Schools programme, which has to date been done with our secondary schools only. So, as Andrew said, we've got a number of changes in the team now. So we've had a new ALN Wellbeing and Inclusion Advisor starting post from September. So one of the first things she's done is to look at the IBIS programme and is conducting an audit and an evaluation of the impact of that over the last year before we then roll that out to all of our primary schools. Whilst that's about improving behaviour in schools, it is part of that culture, about that whole school approach to wellbeing. Sally Amos is also new in post from 1st September, the Health Promoting Schools practitioner. And we have 2 inclusive practice advisors starting with us. So I see us working much more closely across those roles to look at, what are the tools in the toolbox in each school. So there's some consistency, but also a menu, if you like, of things that schools can be dipping into depending on the needs of the children in their settings. So we held a staff wellbeing event in the summer term, where we had a number of practitioners within education, with outside of education, third sector and health, and so on, with stands and information and signposts to support, that head teachers in the first instance were invited to, because they are the people who should be, setting the tone and the culture in their schools in terms of staff wellbeing. And we've committed to doing that for pupil wellbeing as well, and having a similar event after Christmas, where we would have those sort of like a conference type approach, information sharing session, where we invite all those different stakeholders to that event, and then invite schools in to pick from that menu, like a marketplace event, if you like, around pupil wellbeing.
Sorry, can I ask a sort of supplementary to that? I want, because it's having consistency of having trauma-informed schools, recognising there's an awfully high cohort of children with adverse childhood experiences. Is this something that could be explored more also within clusters to make sure that there's consistency about putting trauma information into practice across primary and then into secondary? Because I think the inconsistency is could be quite a significant issue.
Yeah, and it's something we've, Fiona is the new ALN Wellbeing Advisor, and the two new inclusive practice advisors who will be joining us by January. One is for early years and primary, and the other one is for secondary and post-16. So as a team, we can have more of a joined-up approach to this. So one of the things we've committed to doing this year through our ALNCO forum is having our, and we've done it last year as well, is having our ALNCOs working in their cluster groups when we're looking at particular issues, solutions to things, that we would try to have that cluster working approach. And in terms of sort of wider education, that's also a priority for us, and one of our thematic reviews that we've asked the local authority school improvement service to do is to look at cluster working and how that can be improved.
And that happens for the health promoting schools practitioner as well. So using that Sharon survey information I mentioned earlier, she works with schools in clusters to look at what themes are coming up across the primaries and the secondaries and how they can start thinking about how they work together on those things.
Takes us to your question, Lucy. So it's question 18, please.
So it's going down to looking at football net missed. Let me just whiz down there. So simply trying to understand how effectively does missed link within teams within the council?
Yeah, so obviously it's a specialist team that sits within children's services. Historically, for those of you aware, MISS sat within the third sector. So as a result of the sort of the strategic partnership way back in 2003, 2004, thinking about meeting the needs of care experienced young people with mental health, it needed to sit in a neutral agency. So it was able to develop its own practice and model. But since 2018, 19, I think we were a regional programme, and we all sit within and are embedded within each of our children's services teams. So each of the 5 locality teams within this sit within Gwent Children's Services, Torvine Children's Services, Caerphilly, etc. across Gwent, and are very much embedded. So even though they've got a different role from the statutory social worker, they're very much part of core children's services. So are linked in and attend everything that's relevant to attend for children's services, but also equally they're also linked really well into our health colleagues and our education provision. So it's trying to have them linked in to every agency that they need to be part of, really. But I feel really embedded and integrative and different as well at the same time in terms of what they deliver to children and young people. And I think that's what makes it so successful, is the joined-up nature and the position of it within children's services. Because not only do social work staff have access to that intervention for children when children are on our intensive caseload, they also can call the team and get access to psychological advice, signposting, direct therapy, consultation, just having a phone call or a colleague coming and co-working together. So I feel like it is really embedded and integrated. And talking about sort of trauma-informed practice, I think that needs to be with all layers of the system. So from everything, from this committee to, you know, relationship with Jason, but, you know, trauma-informed care needs to be at all layers of the system. It's not just the responsibility of one, as it is everybody to be working in a similar way and understanding children's needs. So I think it really is very integrated. I hope that's what my colleagues would say too.
Shall I give you some examples from social care perspective? So you'll see that we have missed steering group, which runs regularly when we talk about those young people that we feel need allocation for that intensive intervention. But I also have Jenny and Sharon on speed dial for all of the other little bits. We've talked a lot about CAMS and the support that CAMS provide, but actually a lot of our care experienced children won't have access to CAMS because CAMS in general, correct me if I'm wrong, Mark, will provide support to those children who have a diagnosed mental health condition. A lot of our children's emotional well-being is as a result of trauma that they've experienced, so it's not a diagnosable condition. So then we're looking at those services or that support that we can provide, so reparative parenting, access to therapy, and whilst we talk about our foster carers being trained and our fostering team being trained, you'll also know that we have a cohort of children who are actually at home with parents who are subject of a care order, so we need to be supporting those as well. So from a MIST perspective, I'll give you an example. Just last week, we had a young child who'd experienced quite significant trauma whilst at home, and police wanted to but have a conversation with the young person to try and pull evidence together. And we were quite anxious about that. We were anxious about the child having to revisit some of those experiences, the impact that that might have, particularly because we're at a point where we're matching for adoption. And we didn't want any of that, those interventions to scupper what we were doing. We know it's really difficult to match for adoption lately. So we were quite anxious about that. So we called Jenny and Sharon, asked for some advice, and then we pulled a meeting together where we looked at the child's specific needs, how we could support the police in ensuring that this was done in a trauma-informed way and would have the least amount of impact on the young person that we could manage. So we ensured then that we had that multi-agency approach. Police were coming from it from a collating evidence perspective, which they have to, and of course we want that to happen, but we had to prioritise the needs of the child here, and MIST supported us in that. So also in regards to therapy, so quite often we'll see children with additional needs and we'll think they can benefit from therapy. We have no idea what therapy they could benefit from. Somebody will say, oh, play therapy or different. But we then consult with our colleagues in MIST. We'll provide them, a bit of a chronology. We'll have a conversation around the young person's needs, and then the experts in MIST then will guide us to the correct form of therapy that will support. We also have foster carer consultations with MIST. So when we have young people in foster placements whose behaviours are difficult, and foster carers have to parent them in a different way because of their attachment orders, etc. We have consultations where foster carers can come in and meet with MIST and talk through those parenting techniques and the support that's available. So it's not just the intensive work that MIST provides us. They are part of our service, and they provide, I would say, she's sat next to me, but they provide amazing support to our social workers, not just in respect of the services that we provide, but I also think that they support with our social work, our practitioners' well-being, in helping them to understand the behaviours and where we're moving. So, yeah.
That's really helpful, because I think it's good to understand that it's not just a therapeutic service, it's actually a very wide consultative and advising and supporting service to other professionals. So thanks very much.
Question 19 was mine, and we've asked the question on the missing middle. So we'll go on to question 20, which is Councillor Janet Jones.
Thanks, Chair. Mine is relation to specialist roles. The community psychiatric nurse within TIPS is funded through health, and the budget has recently been reduced from 41,950 to 35,000. What impact has this seen from this reduction, and how will this be monitored?
Unfortunately, this week we were advised that the funding has been withdrawn. So we don't have any funding currently, but I think Jason and Jacqueline can probably provide more info.
Yeah, I think to answer the earlier question, in terms of where the funding reduction has been, and I guess how effective or what impact that's had, as a service area, we've topped that up. We've propped that up in previous years. So whereas that funding is reduced in previous years, we managed to maintain a consistent service. However, I think as Claire's pointed to them, with the cessation of that funding, that's a significant risk for us with our service. And I can only surmise really in terms of what the outcomes of that are going to be going forward, but it's certainly a challenge for us.
I think we all know the answer to that. Takes us to question 21. It's Councillor Mark Jones online.
Hi, thank you, Chair. Question on privately commissioned therapy. How often is privately commissioned therapy required in Torvine, and what budgetary impact does it have, please?
Yep, so I couldn't give you an exact figure in regards to what we've spent on therapy. I tried to pull that information together because I preempted that there may be a question around that. It does have a significant impact, and unfortunately, because of the cost of private therapy, we have to prioritise those children that are most at need. So therapies, if I just, off the top of my head, they can range from, cost range, I'm thinking the ones that I've approved in the last few weeks, they've ranged from £2,000 up to £7,000. And they can vary significantly because there's different types of therapy. So we'll have family therapy where parents or carers are involved. We'll have specific therapy for children and young people. There is I would say, quite a robust assessment of need, because we have to be minded that we are commissioning externally to businesses. So quite often we'll have a request for an extension of therapy. So we've had children who've engaged in perhaps 20 sessions of play therapy, and then the play therapist will come back to say this child could benefit from additional therapy on top. And then we have to make a judgment then about whether it's a need or a want, if you like, because obviously we have to spend public money appropriately, but we also have to share a very small pot across a wide amount of young people. So I think that we're trying to manage that effectively at the moment. But we could spend a heck of a lot more if we had the money to spend on it.
Can I just come in there as well, because some of our staff are trained in different therapy modalities, so we offer as well, and I think we saw over 60 pieces of work for Torvine alone last year that the MIS team scooped up and worked through our psychology service, and also we've got therapists within our service who do different clinical trainings who need those hours. So actually it would be a lot more, and it is a lot more across some of the other authorities who don't, so we do try and scoop up, but there is still a need. And with private therapy, sometimes they're not particularly regulated as well as what if you're working in the NHS. So I think we often have a lot of connection in determining whether that therapy is effective, and often that can be how long is a piece of string, because also I do feel that sometimes there can be a conflict of interest in terms of the child's needs and them being privately commissioned pieces of work. But I definitely feel, you know, we're talking about the missing middle, not the missing, we know who they are, but we don't have capacity within the current mental health services. That I do feel like it's an area we could develop more to support families and children to make best use of what we have, because also we could build the intellectual capacity in-house rather than it being commissioned out to private practice. It's no better quality in the private sector. In fact, it's better quality that we have in the NHS to offer. It's just not enough capacity, as Mark says.
Yeah, I'll just add to that. You see, I think we are, and I hope you've got the message that we're kind of really joining up really better than we've ever done, but there's still kind of improvements. And I guess that, you know, certainly from the integrated camps, nobody's excluded, actually, and, you know, you don't have to have a diagnosis. And we offer a lot of these therapies. There are waiting times for those, but, I mean, if we can get better at joining up and make, you know, and ultimately having extended funding, then we can, with in-house, we don't have to be kind of, you know, with general care, but also with the therapy, specific therapies, because yes, I'm dubious about the quality, and I think if we can do it in-house, I think we've got amazing quality amongst all the different partner agencies. We just need to kind of, combine them and join up.
Okay. Apologies, that's my error.
But it's absolutely appropriate that it comes through MIST, first, because that's there, but we're always an option as well. So there's no exclusions around things have to be, we've extended. There are some more specialist teams, but actually people can come in.
Yeah, I think just picking up on some of the points here and sort of explaining the interpretation around CAM support, etc. We know a lot of parents and are looking for a diagnosis for their child's behaviours. And we know as social workers, sometimes this isn't about an organic issue, it's about the parenting that the child is receiving. And our staff are engaging in training. Just yesterday we had a training session that was provided by the attachment service that provided our social work practitioners in understanding how parenting approaches can have a significant impact on child development, and how we as practitioners then can support parents in a strengths-based way, not in saying this is your fault, there's nothing wrong with your child, but more around how can we support you in making necessary changes to improve your child's development. So yeah, we're working along those lines as well in supporting parents to make those necessary changes. Marcus said previously, a diagnosis is sometimes very helpful in understanding children's behaviours, and as a parent it's very difficult to understand that the child's development might be something that you've done. So in ensuring that we're working with parents and engaging them in a strengths-based way, we're adopting our approaches. As you all know, we're working, we've got the strengths-based culture, we've got our mentors, within the teams. We're really rolling that out to encourage people to engage with us in that way and supporting them with their parenting approaches.
Okay, thank you.
It's not completely linked, but I think it's relevant. In the yesterday SRA and ENCO forum, for example, we've talked about, your point about how we all need to be working in a trauma-informed way. We introduced a new inbox back in December last 2024 for monitoring the restrictive physical intervention records that are sent into the local authority. So as a result of that, we've reviewed the guidance to schools and some of the forms that the schools need to send in, and we did training with ALNCOs yesterday, because actually the RPI, the restrictive physical intervention, should be the absolute last resort, and 95% of the work should be on de-escalation. So we did training with all our ALNCOs yesterday on what should be happening up to that point. And it's linked, I think, to what you're saying about parenting. It's about practitioners who are working with the children being able to draft really robust personal support and behaviour plans for children, so they know their triggers, they know what regulated looks like for a child. We talked a lot yesterday about not using the word calm, because I'm not very calm now. I might look calm, but I don't feel calm. So what does calm look like for Claire? What does calm look like for Jason? So we talked about what does regulated look like for that child? What does a good day look like for that child? And how can you get that child back to their good? Which was really about trying to prevent a restrictive physical intervention. So I think it is linked, because it's a similar sort of approach about working with our schools to understand children's behaviours.
That takes us to placements now, and it's question 22 from Councillor Watkins.
Thank you. Yeah, so moving on to paragraph 4.13.4, talking about the circle of security. So the report states that consideration is being made around making the circle of security training mandatory for all foster carers. So how and when will this decision be made?
I'm not sure of the timescales, and we haven't got our group manager who oversees fostering here, but we can certainly come back to you in relation to that. I suspect it's probably going to be more of an issue of capacity to be able to deliver the training, and obviously the number of foster carers that we have. So it would take some time to complete that, but we can certainly come back to you with timescales.
Okay, yeah, that would be great. Thank you.
Okay, that takes us to question 23, which is Councillor Colette Thomas.
I think my question has been answered, but I'll just go through it. With regards to out-of-hours support for support and crisis response for foster carers, are they getting the required support, and is it timely?
Yeah, so we have our out-of-hours support from the family placement team, which runs until midnight every day. And then MIST have dedicated out-of-hours support for the family, children, young people, families, carers, etc. that they're supporting. We do request regular feedback on all the support we provide as part of our annual review process, and certainly no issues or concerns being raised in respect of that from my perspective.
And sometimes we'll have a link up, so if there's a situation happening, the child's known to us obviously with the fostering team, they finish at midnight, we might pick up some issues to continue to support the family. As we spoke before as well, there is the emergency duty team that all foster carers, but that's a pan-Gwent, cross-Gwent provision, and often it's really busy because it's dealing with significant issues around child protection and safeguarding. So sometimes foster carers will say they have a wait time, but that support out of hours is pretty pivotal, I think. I mean, there are access to CAMS, there's an out of hours service as well, and provision. So there are bits of provision that people can access if their children have got a mental health crisis outside of hours. I don't know if I mentioned when I was here last week, but there's just been a national research project on CAMS, crisis services for children, and we've participated in that. So some of the research finding some of our young people and families have directly contributed to the project to say what it's meant to them to have access to things happen, don't they, on a Friday afternoon, Friday evening, a weekend, so that those things are available to families and children.
Thank you. Takes us to question 24, which is 5.5, consultation.
Thank you. That's okay. Yeah, so paragraph 5.5 states, a consultation process is currently being trialled with CLAR and NYAS and through engagement events via the Children's Participation Officer in an effort to promote greater participation of children in their care planning. So when will this consultation be completed?
Okay, that's me. So I'm trialling this. I recognised from the information, as you know, we commission our independent reviewing officers through Checker, and I manage that. I oversee that service, ensuring contract compliance, etc. And part of the information that's provided is about children's participation in their reviews and in their care planning. And what we found is that very few children currently engage in their children looked after reviews. They don't complete the consultation documents prior. If you were to ask, put money on asking any of our young people or a few of our young people what was in their care plan, I don't think that they would necessarily know, which is obviously a concern for us because the care plans are their plans. They should include their personal outcomes, where they want to go, how we're going to support them to get there. And so we're trying to move with the times, although I'm not really very tech savvy, but I'm thinking we're seeing all of these QR codes, and we've got a team now, sort of a Katie's team, a digital team that's supporting us with this. And so I've spent some time with a digital team who are younger than me and more au fait with how the youth seem to communicate with each other, all via mobile phones, sometimes iPads, laptops. So I'm trying to create one of the QR codes that links young people to a survey, and we've tried to create it in sort of a fun engagement, to encourage engagement. So it's not your standard professional questions. It's more about, magic wand questions, where do you see yourself in the next couple of years? What's been really good for you over the last couple of weeks? What are you struggling with? Who can you speak to if you're worried? And I've pulled together a basic survey to start for 11 to 15-year-olds, because I thought that's probably a good starting point. And the long-term team, long-term reunification and planning team, are currently trialling that with some of our young people to see what they think of it, see whether it will encourage participation. It's early doors. I've only had one back so far, but I'm pushing it along. I've also spoken to Phil, who's our NIAS, one of our NIAS advocates and the lead for NIAS in Torfaen, who's also going to use the survey with some of the young people that they're working with to ask their views. And I've also sent it across, as I said, to our participation officer to ask that he takes a look at it and see if there's anything that he thinks we could improve on, but also to discuss it in some of their forums. So I know I haven't asked your question yet, answered the question yet, but when it's going to be completed. But I'm trying to put a 3-month time frame on it because I'd like to move to next steps. You know, how can we make it more child focused? How then can we develop something for the younger young people? I just acknowledge that the written consultation documents are being sent out to foster placements or children's homes. And then it's difficult for young people to provide information where they're concerned about issues that's happening within the foster placement or at home. I think if they can do it on their mobile phones or with support from school, we might get more detailed information. That's the hope. So 3 months, I can feedback after that, if you like.
Okay, so no, that's good to hear. It's good, yeah, that you sort of modernised it and brought it up to date, yeah, because I think you're right. Young people are much more tech savvy than we are, and the way the questions are framed as well needs to be more appropriate. But is it too much to ask that you're also asking the young people what they then think of the new way of doing it, or are you just going to take that response by the fact that they have completed them or not completed them? You know, if it doesn't quite work.
No, the consultation process currently is about what do you think about this form, rather than will you complete this form. So the social workers are taking the form out to young people or taking the QR code out and asking them, what do you think of this? How can we improve it? What can we do differently to encourage you to engage? That's about, the consultation aspect prior to review. We're also trying to encourage greater participation by bringing in greater accountability for our social workers. So now, rather than has the child been invited to attend their review and it's a yes or no, we're also going to be asking them, how was the child invited? What was their response? What could we do to encourage them to attend? And then we're hoping to sort of make changes there. And I'm working alongside Checker, our independent reviewing officers, then to see how we can make changes there as well, so we can get young people more engaged in that process.
Okay, thank you. That's good to know. Thank you.
Just right, in a broader sense, I mean, what we do within our education settings, within our social care provision, is we consult with children, families and young people daily on an individual basis. So I think whilst we're focusing on that, I guess, that aggregate consultation, it's important to recognise that day-to-day consultation we have really, and I guess how we flex and how we change day in, day out, minute by minute, hour by hour, based upon our interactions and our relationships that we've got with children and families, whether, like I say, whether it be in the school setting or social care setting as well.
We've got 2 final concluding questions, and I think, John, yours might have been answered, and then I'll ask Councillor Clark if he wants to say anything. John, do you want to say anything on your question?
Well, I'll ask it anyway. How do we engage with children and young people and their families to seek feedback on the support and provision they receive in order for us to review and continually develop in collaboration with our partners?
Okay, so you'll know that all of our children have care plans, whether that be care and support plans on a Part 4, so on a voluntary basis, child protection plans, and then child looked after plans. All of those plans should be outcome focused, so measurable. So that includes the child's personal outcomes as well. So if there's an outcome that relates to their emotional well-being, that should be scored, and we should be measuring that, not just in the formal reviews, but during our statutory visits or any engagement, as Jason said, our day-to-day engagement with that family. So care planning is the key, I would say, for that formal measuring, but our general day-to-day, we're collating our feedback and consulting with them about how effective the services are, etc.
I
I'd just say, from an education point of view, part of the whole school approach to wellbeing framework is about schools, giving pupils a voice and seeking their views. There are things like the Shern survey, which are more formal, that we've mentioned, and Eston will look at how schools are developing pupil voice in their settings as well.
Just to complete the round with health, we are pushing for outcome measures, which would be a satisfaction measure, and there's a national measure that we would look, ask those questions and try and get those in digital format as well as the sort of paper. A young person rated kind of feedback is the most commonly used is the goal-based outcome, which is meaningful goals that they want to work on, and we check with asking them, are we helping you achieve those goals, and then a clinician rated one, so to triangulate the outcomes. It is a big challenge to make sure everybody gets that, it's on their radar and they do it, so we are having to sort of, whether or not, ultimately we would be able to sort of produce those for all the kids going through all the teams in health, and yeah, so it's a work in progress.
Thank you. My final question is, can members feel assured by the relationship between the Council and Health, and what accountability framework ensures the Council, Health and schools are aligned to regarding children's well-being? My final point is, have we identified any gaps?
I think the Council and the Council's relationship with Health and Health's relationship with the Council is one where we're focused on the outcomes of a child at the end of the day, and I think we've got that shared approach to, and those shared outcomes. We're going to be, and there's always going to be challenges, I think, across both spans in terms of resources and funding. We've already touched upon a few of those, but I think we're at a relationship, or we've got a relationship across both organisations where we work together, be able to challenge one another as well, and have real productive conversations. Where there are any areas there that, I guess in terms of levels of accountability and levels of responsibility, we're able to have those conversations. In terms of, could you ask the second part of the question, Councillor? So in terms of, I guess, the levels of accountability, I think we've got evidence of that by virtue of this taking place today. That joint scrutiny that I mentioned earlier, the fact that there's partners, we've got social care, education and health here as well, being scrutinised. I think this is probably one of the first scrutiny sessions I've been to where we've had an external agency come in and be part of the scrutiny process, which I think is really, really constructive, really productive. So I think there's that there in terms of a level of accountability. I think what we've also seen through the whole process of this inspection is our join up of our regulatory bodies, CIW, HIW and Eston. So again, in terms of that accountability, there's a high level of accountability and expectation there from those three regulators, which again, we welcome that join up. Otherwise, I think if inspections take place in silos, then we're going to miss points. So I think that's really crucial. That join up there has been really crucial. In terms of, we've got the Regional Partnership Board as well for that overarching level of accountability and responsibility. And then sitting underneath that, we've got the Children and People's Strategic Partnership Board, which spans across Gwent as well. So I think there are a number of tiers of accountability where in terms of the outcomes, in terms of the relationships we've got, that we're answerable.
Identified gaps from anybody? Don't listen. Is there anything outstanding that we can help with?
I think it's what we've said throughout the meeting, isn't it? It's not about the joined up nature and everyone trying, it's capacity issues and workforce and staffing and ability to respond in a timely manner to children and families' needs. I still think that's the gap, not because we don't want to, it's just there's not the capacity and resources and the workforce to do that, not just sitting within health but broadly throughout all our systems. I think we've got an amazing baseline, really good partnership relationships and models of understanding that are quite clear now that weren't, but it's building the workforce and resources to match that. I think that's the gap for me.
So the Education Minister made a statement yesterday about the ALN legislation, how there's challenges with the implementation around that, particularly about determining what's a health need, what's actually a behaviour or a learning need. So that's something that's being worked on nationally. I think we're struggling with. We've got a good relationship with the DECLO, so our lead officer within health. But there are issues where we struggle to identify who's best to support or put the provision in place for a learner. Do you want to talk to that?
And the other thing I would add to that is, we're seeing increasing numbers of children entering school with healthcare needs. And so the DECLO's working really closely with us as South East Wales SERP inclusion leads. She comes to our meetings where we're raising this and talking about where you've got children with healthcare needs in school and where the responsibility sits to be meeting those children's needs, where sometimes children are requiring medical procedures, for example, in schools. There's question marks over training, funding, and so on. So that's probably it's not a gap. We know about it. It's just a question of who's filling it and how. But those conversations are being had. So I know, for example, there is a framework that was going to be put out to schools around delegated responsibilities, but education have a view on that. The education unions have a view on that. So those conversations are still taking place.
I was just going to, I think a very broad answer to the question of are there any gaps. I think where there's need, where there's complex need, there will be gaps. Yeah. I think that it would be, to sit here, if we were able to sit here and say there'd be no gaps, then, it'd be a happy day, wouldn't it? But the importance is that we bridge those gaps. I don't think we'll ever get to a point where the bridge totally joins up and, we've got everything in place. But we've just got to get that bridge closer and closer and closer to the
Thank you very much. That leaves me to ask Councillor Clark if he's got any comments.
There's nothing to add from our professional officers. That's why they do the job that they do. They far outrank me in that. The reassuring thing, excuse the voice, and the reason I'm not there today is I don't want to give you my germs. The reassuring thing for me, and hopefully yourselves, is none of this has come as a surprise to me. I am constantly briefed by officers on this situation. Jason's kindly put me on a safeguarding board as well, so I'll be even more in tune with those elements of it. Leaders, and I represented our leader on Monday, met with Lynn Eagle ahead of the announcement that Andrew just referred to, and I would commend members to read the paper, the summary of what Lynn Eagle said. She was very keen on getting users and the thematic review all published at the same time, and the results of the tribunals in respect of placements. So that might be some information that members of this committee would like to look at. Similarly, I meet with the 21 equivalent members across Wales, and we did so, I think it was about half hour before Lynn made her statement. And it's very similar issues across the 21. You wouldn't expect it differently. But I think the hope that I hold out for the Gwent region, sorry about the voice, and I'm no longer a member of an Iron Bevan Health Board. My term is finished, so I'm not saying this to cozy up to them in any way, shape or form. But the relationship that the Gwent authorities have with ABUHB, I think, is far more positive than my colleagues in other local authorities outside the ABUHB area. It's not perfect. It never will be perfect, and they will say the same about us. The gaps that Jason just referred to will always exist, even in a perfect situation. But I think we are best placed to deal with them. We are working together constructively, and I certainly think the level of cooperation, and can I not just say between ABUHB, between our own departments. I think one of the most successful things we've done as authority is become children, families and education. You've got that cross department, well, it's a single department now. You've got that cross department view where you're not all sort of fighting and blaming and saying it's this person, it's that person. So certainly I would say in the last 8 to 10 years, the advances we've made in partnership working, and at the end of the day, it's the same child. whether you're health, whether you're Torvine education, whether you're Torvine children's services. So I think it's a great improvement, and the report and your questioning today is a credit to the team. I think that's all I wanted to say, really, Chair, before I go off and sit in a dark corner and nurse my colds.
Thank you. We hope you get well soon. Thank you, Councillor Clark. That concludes our questions. Can I thank the executive member officers and invitees for their time and contributions to the meeting, and ask if they'd like to leave now to go and have a nice toilet break, if I were you. So, thank you very much. Members, can I remind you that the meeting is still in formal proceedings and we are still being webcast. Thank you very much, everyone. Thank you. Thanks very much. May I remind members what has been asked of the Scrutiny Committee to consider when coming up with their recommendations. We'll pick up James when she comes back in. Members have been asked, invited to assess whether the approach being taken by the Council and its partners to support the mental health and well-being of children and young people in Torvine is adequate. Do we determine whether or not the actions being taken and proposed will address the recommendations of the review and deliver an improved support service for our children and young people? And finally, provide recommendations to the executive member for children and families and education on the areas for improvement or development in our strategic approach to support the mental health and well-being of children and young people. That's a mouthful. Do members have any specific recommendations that they would like to make on the report?
Yeah, Chair.
Janet?
I've got, well, two, possibly three. 4.10, when we were told that for the psychiatric nurse, I think that's really frightening. And I don't know if it's a recommendation, or again, I can do it, that we urge the authority to seek funding, because this could have a devastating impact on the service provider.
I'm not sure if we can have a recommendation on those lines, but we can put something
Could
in the comments about
them, please? And my other one was about the possibility for consideration having an out-of service north of the borough for young children, please, because I think that's vitally important. I think I probably duplicate on something else, so I do apologise, Chair. The other one was about a budget on an early question.
But if I just come in there perhaps to just help clarify on that point, obviously it's difficult in terms of budget because that wasn't council funding that funded that post. So it might be more applicable to recommend to the executive member that he works with the teams to consider what the potential impacts of removal of that post and that funding will be, and then identify mitigations that will address those potential impacts. Perhaps that would be a way around it. Okay.
This is in relation to 4.4.3, looking at the relationship between the early years service and linking with neurodevelopment pathway. I would like, again, I'm not quite sure how to word it, but I think there needs to be a strengthening communication with the early years service, and I particularly think there needs to be a recommendation about looking at how the health visiting service is developing, because that's quite key with picking up, with looking at parenting issues and, you know, family dynamics. So I don't know if you can make that into a concise recommendation. I think it's improving the communication between those different age groups, particularly the early years service. Does that
quickly, sorry. Obviously, they did make the offer that Charlotte would come back to your question with regard to earlier, so if that's perhaps added to the action sheet and you get a briefing in response to that question.
Okay. Chair, only one more. It was about, sorry, I beg pardon. About recruitment, we say having difficulty to recruit. Is it something we consider that we discuss in other by offering like a bursary for our trainees and retain them for a couple of years? Because if this isn't that, it's only going to get worse if we cannot recruit staff.
Yeah. I think they mentioned that, didn't they? That they're trying to start at an earlier stage in offering things. You did have one point, Janet, before you go, on the transport at the north of the borough support. You mentioned that. Yeah. Okay. Yeah. And Victoria, did you have any recommendations to?
Mine was the same recommendation about looking at a provision for counselling in the north of the borough.
Yeah, okay. Any other recommendations? I thought they answered questions really well. You know, it's good to have a joined-up approach with it all. I thought that was really useful to have a joined-up meeting like that on the information.
Chair.
Sorry.
Sorry, Chair. I'd just like to, as a recommendation, or just get on record that 4.11, I think it's imperative that we do bring more therapies in-house. Obviously, with budgets being as they are, you know, it's very important now that we do get it in-house to save us. Well, anything we can save is for the best.
Yeah, and the quality of the service as well, Mark. Yes, thank you very much. Yeah.
Yes, yeah, because they didn't seem very enthused by the quality of the private therapy, did they?
No, they didn't. Anything from Councillor Slade?
No, nothing from me. I thought they answered the questions really well. But I can't think of anything, any recommendations. So, but thank you, Chair.
Sorry, can I just suggest as a recommendation to look at how effective, because they've just recruited the ALN practitioners, haven't they? So it would be useful to see how effective those posts are in kind of like, what's the word? In that early intervention. Yeah.
Geraint, did you pick anything up that we've missed? Sorry, busy writing there.
I don't think so. There were any other possible actions, that's all.
Sorry, I was messing with the microphone. Sorry, you may have discussed this when I was out of the room, but I made a note on the question about the participation of schools in the Health Research Network survey. She was going to come back to us with numbers. So we know that 100% signed up, but obviously they've still got time to send them in. So she was going to come back to us with the numbers of schools that actually have submitted them.
Something I picked up on, I think, relates to what Councillor Williams was just saying about the ALN posts. Claire Williams mentioned, obviously, the cluster approach that they were looking to improve and explore. I didn't know if there was a recommendation based around that.
Yeah, that would be good.
Thanks, Chair.
Okay. Final. Date of next meeting, agenda item 5. The next joint meeting of Children and Families Education Overview and Scrutiny Committee will be on the 4th of December 2025, where members will be scrutinising provision and outcomes for children looked after. Thank you very much for your attendance. I now close the meeting. Joint chair of this committee, may I thank members and officers for their ongoing support and contributions to our meeting. I now close the meeting. Thank you.
Thank you.